Hi everyone, my name is Veronica Darling, and today we're going to be talking about the opioid crisis. To begin, let's talk about what causes the opioid crisis. Now, since the turn of the century, there has been an increase of opioid prescription and use. Now, this has led to an increase in the number of overdoses and deaths. Within this discussion, we're going to be talking about the historical background of this problem, the data and analysis, what impact it has on communities, the impact that it has on the legal system and law enforcement, the impact it has on healthcare, and methods of improvement, especially ways that healthcare providers, most especially nurses, may aid in combating the crisis. Let's define the problem. Now, prescription drug abuse is defined as the use of a drug for purposes other than what it is medically intended for, such as the use without a prescription or the use to mainly experience a euphoric state. It's not used to treat pain. Now, different types of opioids most commonly are morphine or oxycodone. Of course, there are many, but those are two very common ones. Now, opioids are analgesic medications that bind to receptors on the nerve cells in the spinal cord and on the brain. These medications are supposed to be used short term, specifically for pain relief. And they are also supposed to be used under the direct supervision of a physician or advanced practitioner. Now, let's talk about the effects of abuse. So, overuse, misuse, abuse of this type of medication can lead to tolerance and dependence. Now, when someone is dependent on an opioid, it can drive them to crave the drug, and they may feel the need to obtain it by whatever means necessary. And when someone becomes dependent on one and they don't have it anymore, they can start to withdraw from this medication. And some withdrawal symptoms include nausea, vomiting, muscle aches, diarrhea, fever, insomnia, and even a negative, very grumpy mood. Let's go over the historical background to get an idea of what's causing this problem. Now, physicians have a moral obligation to treat patients' pain, no matter what they say it is. The physicians have to ask the patient what their pain level is and then take them at their word for it, because we can't decide if that patient is feeling pain. We can't feel what they're feeling. So we have to take what the patient says and treat it. That way we can relieve their suffering. Now, according to the International Pain Summit, adequate pain relief is a basic human right, and that physicians have an obligation to treat it. Now, unfortunately, opioid medications are very effective for treating pain. That's what they do. That's how they work. Now, another factor in this crisis is practice changes. Now, pain as a fifth vital sign is fairly new since the 1990s. Now, a pain assessment is utilized and is now a standard nursing practice. So once pain became a fifth vital sign, it became our duty to treat it. And because of this, there has been an increase in a very liberal use of prescription narcotics to treat this patient-reported pain. And not surprisingly, there has been an alarming rise in the use of prescription opioids to treat pain. There has also been a very, very dangerous misconception that if opioids are used for pain relief, that you wouldn't be able to get addicted to it. However, we know that this isn't true. We now know that even a short-time use, even a single prescription, can cause an individual to become addicted to an opioid pain medication. Now, because of this, pain is a fifth vital sign and an overprescription of medications, there have been leftover medications in the household. Now, because of this, patients will keep hold of their medications that aren't used, and they'll keep it in their house. They'll keep it for later. And because of this, there has been other people have access to it now that who aren't intended to. This can be very, very dangerous. Let's talk about the data and analysis. The opioid crisis has had a very significant burden on the economy of the United States. In 2018, the estimated cost to the U.S. economy related to the opioid epidemic rose to over $630 billion. Now, this cost number is related to healthcare, premature death, criminal justice, child and family assistance, educational programs, and obviously lost productivity related to absenteeism and work impairment for people who are taking these medications. This cost is also related to the cost of hospital admissions related to opioid misuse, while also, especially for the emergency department, in managing opioid overdoses. Now let's talk about the lives lost. So in 2016, the use of opioids claimed the lives of approximately 40,000 people. If you look at the graph to the right, these are our numbers here. 2016, 40,000 people. Now this is stated to be the equivalent of a September 11th attack every 3 days. Even worse, in 2017, the use of opioids claimed the lives of approximately 70,000 people. That is almost twice the amount of lives lost in a 1-year span. That's how serious this problem is. And let's talk about the percentage of global population. So in the United States, the U.S. represents roughly 4% of the global population. However, the United States also represents 27% of the world's mortality from drug overdoses. This being said, the opioid deaths exceeds breast cancer, guns, firearms, and motor vehicle accidents. The life expectancy in the United States has significantly dropped since the 1990s, especially for people under the age of 65, because these are the people who are at most risk for or who are more frequently going to use opioid medications. And additionally, the national death rate from opioid overdoses in 2016 was approximately 21 deaths per every 100,000. That being said, the opioid crisis is the most deadliest and most costly in terms of lives lost, decreased life expectancy, lost productivity, crime, violence, and the devastating impact of addiction on families and communities. Now let's talk about the impact on communities. So misuse of opioids can affect people of all socioeconomic groups, all genders, races, ethnic groups, but also pregnant women. So unfortunately, pregnant women make up a very good portion of opioid consumers, and this causes many infants to experience neonatal abstinence syndrome at birth, and also causes the death of a lot of neonates. Elderly adults are also affected by the use of opioids. Older adults are especially vulnerable, and the rates of overdose from opioid pain relievers are the highest in this population. This is because the elderly tend to be more sensitive to the opioid sedating effects, and they tend to succumb to falls and head trauma because of that, therefore increasing their death rate. Now, the opioid epidemic affects everyone, And unfortunately, a little fact is that more than half of respondents have a personal connection to someone who has a connection to prescription opioid use, with 16% of these people knowing someone who personally had died from an opioid overdose. So this does really affect everyone, and it's a problem. Let's talk about the impact it has on the legal system. Now, there are stringent laws which healthcare providers have to follow. Healthcare providers are required to only prescribe a maximum of 7 days worth of opioids as a first prescription. And they are also required to counsel their patients on the risks of taking opioid analgesics. Now, these laws are good. They really put a tight rope on the prescribing of opioids now. However, there is a downside. The limiting of this prescription makes it abundantly harder for people to attain, especially people who misuse this medication. People that have been misusing opioids and now can't obtain it will turn to illicit substances such as heroin, and these drugs are often much more potent and have caused an increase in the production and distribution by people running illegal operations. So there's a lot more crime now, unfortunately, because people want to get their medications when they can't get it from their providers. So let's talk about the impact on healthcare. Now, the prevalence of this addiction is very, very high. Unfortunately, the percentage of people who actually seek treatment is fewer than 10%. And the people who actually do seek treatment often find that the healthcare workforce, which includes the nursing staff, lacks the sufficient skills and education that is needed to implement the most cost-effective and even evidence-based treatment. Some treatment options for opioid addiction is methadone. Methadone became legal in the 1970s as an addiction as a treatment for addiction, while also there is buprenorphine, which is more easily pronounced and known as Suboxone. This was developed as an alternative to methadone. It is an opioid agonist. This prevents symptoms of withdrawal and cravings while also preventing the abuse of other opioids. Now, this drug requires fewer federal regulations for dispensing than does methadone. Therefore, it's more easily prescribed in an office setting. Now, let's talk about the methods of improvement. So, throughout the United States, there have been many laws that are passed that limits the prescribing practices, therefore limiting access to drugs. One of these laws is known as the Substance Use Disorder Prevention that promotes opioid recovery and treatment. Now, this is also known as support. Now, this law implicated the greater use of naloxone by first responders and permanently authorized nurse practitioners and physician assistants to prescribe medication-assisted treatment, while also providing a 5-year authorization to certified nurse midwives and clinical nurse specialists to prescribe these MATs that we just previously discussed. There are also many policies that are in place that are meant to help improve this problem. There is a continuing medical educational requirement. Now, this mandates that physicians receive postgraduate training on opioid prescribing, addiction, and other such topics. There are laws related to pain management clinics. These laws regulate clinics' policies that manage the treatment of chronic pain. There are opioid prescribing guidelines. These guidelines provide recommendations to providers on opioid prescribing practices, like things such as the selection, dosage, duration, titration, and even discontinuation of the drug. Additionally, there are anti-doctor shopping laws. Now, this refers to patients who go to multiple doctors seeking opioids without their other provider's knowledge of the other prescriptions. Now, these laws would prohibit the patients from obtaining drugs by fraud or deceit. There are also drug supply management policies. These policies limit opioid prescriptions by restricting the dosage that can be prescribed. There are also PDMPs. Now, these are electronic databases that track controlled substance prescriptions, and this aids in identifying patients that may be at risk for opioid use. There are also naloxone access laws. These laws are meant to increase the access to naloxone to those that are able to administer it, and this would help in decreasing the number of deaths that are related to overdoses. Lastly, there are also Good Samaritan laws. Now, these laws provide legal protection for bystanders who step in to help in an event of an overdose. Now, let's talk about the American Nurses Association stand on this epidemic. The American Nurses Association, or we're going to call it the ANA, holds the position that nurses play a fundamental role in combating the opioid crisis. They also stress the importance of the need to remove barriers. Now, these barriers could include an evolving best practice guideline with non-evolving healthcare providers. Another could be social stigma to people reporting pain. Providers may not really believe their patients, and that's a barrier. The ANA also lists objectives for safe and appropriate prescribing. They list 3 objectives. These include improving clinical education and decision-making to reduce inappropriate prescribing. Second objective, enhance prescription monitoring and health information technology. Third would be support data and best practice sharing to facilitate appropriate prescribing of and dose storage and disposal. That way they can prevent prescription opioids from reaching the unintended individuals. They also list methods of safe storage and disposal. The ANA says that you should store medications out of reach and sight of children. Make sure that the safety cap is always locked. Keep opioid medications in a locked cabinet to prevent unintended use. Some disposal instructions. The instructions should be listed on the medication bottle itself, but if that's not available, the ANA recommends that these medications be disposed of through medicine take-back or disposal in the household trash, or even flushing it down the toilet. They also say that all expired or unused medications need to be removed as quickly as possible from the home to reduce the chance of misuse. And then lastly, like we said before, the ANA really stresses the prevention of the stigma. If the stigma is gone, it would really increase the number of patients to come and seek treatment for this problem. Now, within the nursing practice, nurses are at the front line for patient care. Thus, it's really, really important for nurses to be ideally trained and situated to address this problem because they have very close interactions with patients and the patient's family. When patients are not able to empathize with their patients or they don't care to take care of patients with this disorder, there's ultimately suboptimal care, and that needs to be addressed. Nurses can aid in this epidemic by implementing prevention measures. Now, these prevention measures could include minimizing the stigma. This would help facilitate those who suffer from opioid use to feel comfortable in seeking treatment. They could train and educate first responders and families on how to administer naloxone. Another prevention measure could be, through the availability of early detection and prompt intervention of those who are at risk for opioid misuse, while also aiding in maximizing the patient's health despite being afflicted with opioid use disorder. Nurses must be knowledgeable of this problem. Nurses are very involved with the administration of this medication to their patients, so it's really, really, really important that they are aware of the problem itself and they understand their role in aiding in the prevention and reduction of further opioid use. It's also very, very important for nurses to have a good nursing assessment. Nurses have to know how the opioid works in the body. That way they can know what to look for and different side effects of this medication. Their assessment skills are very important to identify when this medication is reacting poorly. They have to be able to monitor their vital signs, their level of consciousness, their respiratory rate, all of which can be seriously affected by the use of opioid medications. Also, nurses have to do patient teaching. It's really, a lot of patients are very opioid naive, so they have to be adequately taught when it's being administered to them. Also important, it's good to educate them when they're going home on prescription opioids, especially for the first time. They'll need to be educated to slowly wean off this prescription to help reduce the risk of potential abuse. Now, Healthy People 2020 has lists of multiple health problems, one of which is addiction, and they list objectives for this specific problem. Now, these objectives include, but are not limited to, increasing the proportion of people with substance use disorder who got treatment in the past year, reducing the proportion of people who had drug use in the past year, reducing the number of people who had opioid use in the past year, increasing the number of admissions for substance use treatment, increasing the proportion of people who get a referral for substance use treatment, along with increasing the rate of people who have opioid use disorder to seek addiction treatment. Now, if these objectives were met, it would tremendously improve the opioid crisis. Increasing the number of people getting treatment while also reducing the overall number of people who have this disorder would obviously tremendously help in reducing the opioid crisis. What are some nursing interventions that we can do that would help aid this problem? Now, all nurses and even all healthcare providers need to be a patient advocate. We need to advocate for a change in a perspective on how patients with opioid use disorder are viewed. It's very important to decrease the stigma that lingers around the misuse of opioids and transition this negative perception of moral weakness into a more positive view of a treatable disease. Using this more humanistic and positive approach may improve patients' recovery rates and over morale. And since nurses are the ones administering this medication most frequently, it's important to know